This day is celebrated to create more awareness on mental health. I'm Mary Mesa from the Youth Arise organization Healthy. On this day, we embarked on a journey to Cape Coast to interview Emmanuel Seram Sechi, a pharmacist who is very knowledgeable in mental health. Stay tuned and be informed. Thank you.
The World Health Organization defines mental health as a state of well-being in which an individual can realize his or her own abilities, can cope with the normal stresses of life, can work effectively and productively, and can make meaningful contributions to his or her society. In other words, an individual must have the ability or capability to think, to feel, and to act in ways that will improve or better his or her quality of life while respecting personal, social, and cultural boundaries. Causes are largely unknown, but there are possible associations with biogenetics where there are problems with the dopamine and serotonin receptors. We have the use of illicit drugs like marijuana, amphetamines. We also have a possible viral infections or bacterial infections like cerebrospinal meningitis or HIV/AIDS. We also look at certain birth defects in the brain. We also look at economic factors like loss of job, unemployment. These factors have been shown to have significant impact on mental health. Irregular sleep pattern, waking up usually too early or going to sleep usually too late, or insomnia, that's finding it difficult to sleep, isolation, odd behaviors, hearing of voices, and the lack of energy are some symptoms of mental health diseases. When you believe you have challenges with your mental health, the place to visit is a psychiatric hospital or a registered psychiatrist. You don't have to wait for the condition to worsen or aggravate before you resort to the hospital. There are other services there, like the counseling service, where you can walk in anytime when you're having issues. We support them, we encourage them, and we assist them get the proper and necessary health care from a psychiatric hospital or a registered psychiatrist. Say yes, COVID affected mental health significantly. There were loss of jobs, there were loss of life due to the disease, there were lockdowns, our normal way of life was taken away from us. And these are all factors that affect us or that affect our mental health. So I would say yes. Yes, I think social media is having a negative effect on mental health. We look at cyberbullying, on these platforms. I don't want to mention names. There are rumors, lies that are being said about somebody, that can cause a lifelong scar. This can make the person depressed. All this affect our mental health. Also look at addiction and lack of sleep. People become addicted to social media. They spend most of their time there. They ignore certain things, important things in their lives, like relationships, like work, and other things that they have to do to improve their quality of life. We also look at people isolating themselves and then replacing social media with their relationship and friends. Research has said that most people who spend a lot of time on social media are the most lonely people. I encourage periodic mental health screening. We should consult the appropriate healthcare practitioners. We should limit the use of social media to avoid addiction. And we should help encourage individuals having mental health challenges. And then we should always smile and then learn to be happy.